Hey everybody, good afternoon or morning or evening, depending on where you're joining us from in the world today. We're super excited that you've joined us for this session. We'll give it another 30 seconds or so before we get rolling, and I will go ahead and share my screen in the meantime. So for now, just for another couple seconds, just sit back and hang tight. Okay, friends, we will go ahead and get going. We are super excited to have you all join us for today's session. We have a really good one planned. I would love it just to make sure everybody can go ahead and hear me. If you see in your chat feature, just please go ahead and type in a message to make sure. We'll just make sure audio is good before we continue to go. Just type in a message that says, "I can hear you." And once I see one or two of those come through, we'll get started. Great. It looks like we've got a few folks that have responded in, which is awesome. Can hear you too. So a couple of things today. A couple of housekeeping things before we get going. First and foremost, we're so grateful you came. You do have a GoToWebinar panel that you'll see. Go ahead and ask questions throughout. So we want this to be as interactive as we can. We will address some questions as we go through this session today, but certainly we'll make sure that anyone who submits a question during this session, we'll do our absolute best to route it and answer it throughout the session today. So please feel free to reach out. We do have a couple of interactive polls to make this a really engaging session for you all today. Feel free to participate in those, but also just feel free to ask us anything that we'll get to throughout the presentation today. So without further ado, let's get going. We wanted to start off today by saying just a quick thank you to everyone on the call. We recognize that a few of you, given the topic today, are on the front lines and serving in emergency rooms and long-term care facilities across the country, but all of us, including us here at Provider Trust, are doing everything we can to keep our front lines going and to help out where we can. And we're really, really grateful to be in healthcare right now. It's just an incredible time to serve, and we've been just so humbled to be able to help. And from what we've seen from so many of your organizations, almost everyone on the phone today works at a large health plan. And just to see the generosity that's come out from your organizations, it makes us so proud to be able to work with the organizations that you all work for. So we're grateful. We're here to serve, and we're just humbled to be your partner through all of this. Today, we just have an incredible subject matter expert today. So myself, the guy talking I am Dave Servadidio. I lead our marketing at Provider Trust, but I am just honored to be able to really showcase Mike Worth, who's our Director of Market Development, and he's also our health plan subject matter expert at Provider Trust. To say I learn from Mike every day about health plan operations would be a dramatic understatement. His knowledge of the space, his knowledge of the industry, how to best set up operations as it relates to preventing fraud, waste, and abuse out of a health plan's operations is just tremendous. I'm so excited for him to share some of his knowledge from the industry with you all today. Y'all are in for just a real treat. Today's session, when we first put this on the calendar, this was before COVID-19 hit us all. We've adjusted a lot of the agenda that I'll go through in a second to really keep it relevant so that it's actionable and the folks on the phone can take specific takeaways from this session and go put them into practice, potentially even in the next few days. So the title of today's session is Managing and Monitoring Non-PAR Providers Before, During, and After COVID-19. And we will talk specifically about those three states, before, during, and after COVID-19, to keep this really relevant and really impactful. A little bit about us. For several of you on the phone, this is your first time webinar with Provider Trust. We are a healthcare tech and data company. We are based in Nashville, Tennessee. We deliver insights from America's healthcare capital on topics of fraud, waste, and abuse, compliance, and credentialing. Our mission and vision and vocation at Provider Trust is really, this is our belief statement. We believe that a smarter healthcare makes a safer healthcare. And what we do very tactically is monitor healthcare populations to identify compliance and credential issues before they impact patients. That's the way we partner with provider organizations and health plans across the country to keep healthcare safe and to create a safer healthcare for everyone. So with that, that's enough background. Here is the agenda for today, and it's a good one, friends. The first section that we'll get into is just understanding fraud, waste, and abuse risk in non-PAR providers, and really tying some numbers to that. What does that risk profile look like within that population network? We'll talk a little bit about exclusions for those on the phone that know us. We do spend a lot of time in that space, but just general fraud, waste, and abuse risk and what that looks like for non-PARs. We will then go into the COVID-19 impact as it relates to managing and monitoring non-PAR providers. We'll talk through specific updates as it relates to COVID-19 that relate specifically to non-PAR providers and out-of-network claims management. And then the third is we'll leave you with best practices for managing and monitoring based on what we are seeing and hearing from the marketplace and from our partners today, from some of the largest health plans in the country, which is just recommended practices to move from manual effort to integrated data and actionable insights, and how to wrangle this part of the population that we know can lie on the fringes but cause just a tremendous amount of manual toil within your organizations. So before we get going, we wanted to start off with a little bit of interactivity and our first polling question. And I will go ahead and launch this while I read the answers. The first polling question is launch poll, and you should be able to see this on your screen, is which department or function at your organization currently owns non-PAR provider network management and monitoring? So the options here are provider network or operations group. We see this sometimes in credentialing. So we do often see this in IS or IT, payment integrity, or any sort of other. And if it is other, would actually ask as we start to close this out, would love if you just submitted that in the questions or in the chat. Just let us know. We're certainly looking for different insights across the organization and across the market. So we'd love to hear from you. So I will go ahead and close this poll and share the results on the screen. You all should be seeing this, and the results are about 2/3 of the folks on the phone are typically the ownership for non-PAR management and monitoring is provider network or operations. About 8% said credentialing. About 21% said payment integrity, and 4% said other. 0% said IS or IT, which is really interesting because we do see that being an ownership group at other health plans across the country as well. Go ahead and hide results. And so the last slide here, a national problem, and then I'll kick it to Mike, is national healthcare fraud, waste, and abuse is a nationwide problem. Estimates show that anywhere from 3 to 10% of the nation's healthcare spending can be attributed to healthcare fraud. Some of the most common examples that we see and we interact with on an ongoing basis is phantom billing for unnecessary tests or procedures, upcoding or billing issues for more expensive supplies or procedures than were actually ordered or performed, excessive billing for more than 20 hours of services in a day, and fake billing companies. And this is an area that we see all the time, such as phony pharmacies that disappear after collecting reimbursement. This is a story that you all know very well, sadly, of what we see. And so the first section, and this is where I'll turn it over to our subject matter expert, Mike, to talk about a little bit about the fraud, waste, and abuse risk in non-PAR providers. Mike, take it away.
Dave, thank you very much for that setup for our conversation today, and as well for the very kind introduction about my expertise in the space. For those of you who were paying attention or who were logged in when you saw who the presenters are today, you likely saw my haircut. So really my expertise solely comes from the fact that I have been working in healthcare far, far too long. When thinking about this challenge that we work with our plan customers and with so many organizations across the country, I try to think about how do we kind of frame this, or how would we consider this business issue that we're all contending with, and I really thought no further than a student who's going to school. That's what I thought of. The school picture here, this is a freshman in high school. I'm sure many of you are spending a lot of time with students in your own families, probably more time than you had really anticipated doing or than you had thought you would be doing at this point in your lives. So for all the families that are dealing with that, certainly our hearts go out to you. But in terms of thinking about the connection between a student and a non-PAR network, we have such limited information to be able to understand this profile or this image. You might start to collect or gather some information. It looks like a lot of other pictures that you might see out there. And if at the right time, you happen to have insight about this individual, you might know some things. You might know that this student is actually a very good one, who's in AP classes, who's very dedicated in terms of that work. If you reviewed report cards, we might have the benefit of knowing a lot about their not only diligence in the classroom, but how they behave and how they observe and interact with others. This is an athlete. This is someone who volunteers and works with students with disabilities and helping to get them engaged and interacting with their peers. These are all things that you might know. And I happen to know these things because this is my son, Miles. Miles is a freshman in high school. What you also might not know is that 1 year ago today, and we know this as a family, is that Miles received an ISS, an in-school suspension. One of those things that only a student who's not a good student might get tacked with at some point in time. And the reason that it's important to be able to understand this is that if you would have happened to interact with Miles, or if there was that transaction of information with Miles on that specific day, you might have a very different picture about who this individual is as a student. Same way with the other days. You may have had a very different interaction around it. But the two things that I know about this picture and I know about my son, and that you can start to extrapolate for other parts of our world, is that having the full picture in a very limited amount of time is very difficult to be able to access. But number two, even if we do have a blemish on our record, or if we have some type of issue that we want to be able to understand, culturally, and even as a family, we want to be able to understand what is that issue that happened, and then how do we address it, and how do we make the right decision moving ahead, okay? And what we're going to do is try to set that up and extrapolate that to how we're going to be able to work with and consider this whole ecosystem of non-PAR providers. Let's think about where this connection goes, or kind of how this makes sense here. By the way, Miles is doing just fine. He has not received another in-school suspension, because everybody's probably waiting with bated breath on that. All right. When we think about a provider ecosystem, this is generally a way to visualize how we think about how do we manage or ensure not only eligibility, but veracity in terms of our provider networks. We go through enrollment processes, we go through contracting, we go through extensive credentialing and re-credentialing processes, some of which are antiquated, some of which are incredibly advanced. We help to monitor or manage the data that is flowing about this provider throughout their duration in their network and that participation. At some point in the chain, and this varies wildly amongst the organizations that we get to work with, a non-PAR provider enters into this equation. There are many doors that they come in, and if we know one thing, it's that when we've seen one healthcare organization, we've seen one. And where this non-PAR provider enters into the equation is widely varied, and as well, sometimes we try to solve it in different ways, shapes, and sizes. As you saw, even on the poll, amongst the participants here, we have several organizations that are solving the challenge of monitoring non-PARs through our provider network or provider ops groups. Sometimes we see that non-PARs are entered directly into those platforms and applications. Sometimes we look at it as at transaction, where we'll see claims and adjudication where that provider ops team is being able to pick that up. Or we'll see even on a retrospective where SIU is going back in and trying to do that level of investigation, okay? So it's varied. There's a lot of doors where they come in, and it's not a perfect place where it gets consistently owned and operationalized. Now let's keep it hard and keep in mind, why does it matter? Why should we be talking about this today? What's the root of this? And I always like to try to help our clients and our partners remember that at the end of the day, this is ultimately about our customers, our members that we're serving. They have an expectation that they would have access across the entirety of any provider with whom they would be able to interact. And certainly, even in that interaction, if they're removed from their traditional provider networks or if they're removed from their traditional points of care service, that they have an expectation that they would be safe and that they would be well taken care of, and that those providers that they're being able to go engage with are ones that we would wish our own family members to be able to be seen by. But internally in our organizations, this problem gets more challenging and it gets more complex. To try to understand a full picture of what's actually happening to ensure eligibility across these massive and dynamic populations matters significantly. And to be able to manage that data in an efficient way is something that we see many plans challenged with today. There are significant amount of costs that can go along with these groups. And ultimately, we know that we've got to be able to not only fulfill our contractual obligations, but we've got some very fundamental requirements that can leave us exposed to a lot of risk and our own additional costs that we would incur should those challenges come ahead. So knowing that this is something that we all understand the business issue that's associated with it, we also understand that there is an order of magnitude difference in typically what we see in terms of par utilization and non-par participation. So Dave, you can go ahead and go to the next chart, please. Thank you. While we see higher levels of utilization out of a par network, right? Repeat frequent flyers, repeat utilization, you would anticipate that with any par network. The volume or the number of transactions, if we looked at side by side, just the unique number of NPIs for individuals and entities that come from out of network is oftentimes disproportionate or much higher, okay? In fact, it can be even up to, in some of our clients that we work with, where they've got a wider member population base, we'll see a 10 times the number of individuals and entities in their non-pars than their pars. This doesn't hold suit for everyone, but regardless of your overall reach and your complexity, we know that the order of magnitude can be much greater, even though the utilization patterns are not exactly the same. But inside of that volume is where the dissonance comes and where the risk exists. The amount of providers that we're talking about is not consistent with our PAR organization. If you think back to our ecosystem that we laid out, we know that we put through our PAR providers an incredible vetting process to be able to get them to that moment in time. We all understand that we're helping to mitigate a lot of that risk. But even if you look at this scenario where we have roughly a non-PAR, a network of individuals and entities, the non-PAR volume is just over 500,000. The PAR provider network is just shy of 350,000. That ratio is roughly a 1.3 multiplier or ratio. Okay, so it's a relatively consistent population. But when we went in and did the analysis on this group and understood how many exclusions actually came out of or did we identify in all of these transactions, it was over double the volume that we found in the non-PAR population than the PAR population. So when we start to think about where we can identify fraud, waste, and abuse, not only in a proactive sense, not even only in a retrospective sense, but if we were trying to think about this in a proactive sense, it would behoove us to be well out in front and be able to monitor more effectively what we can do with respect to the non-PAR population. If there's anything that I'm introducing here into the equation, gang, that's new, it would surprise me, right? This is just to help level set and to help us understand what's the issues that we're contending with today. But if we look at even putting our best foot forward in a population, in an organization that we work with, we examine only two states, claims that are associated with only two states. We looked at, it's a look back over 12 months, and we identified nearly 3,000 providers out of a total population of almost 150,000. We identified 3,000 providers and over $14 million in associated claims. We identified these issues almost instantly, and we found all of these issues even when this organization had monitoring processes already in place. So all of those practices, all of the gates, all of the methods to be able to help identify these issues had slipped past the cracks, even with our best intentions, because of so much of the complexity to be able to manage through this. Now, Dave later on, Dave, by the way, Dave was actually a significant part of this research and this work that we did. Dave's going to actually walk through a deeper dive on this case for us to help you kind of understand what are the ins and outs around it. But wanted you to just see that it's not just the volume, it's the disproportionate challenges we have and the associated risk that we could find even when we put our best foot forward. So fundamentally, the risk that we're facing here is with our ability to try to go back and recoup payments or proactively address dollars from going out the door with a group of providers that we would deem ineligible. To be able to quantify this, the fraud, waste, and abuse is rampant, especially so in this population. I have refrained from telling the horror stories that people typically like to tell when they walk through a non-par population or try to explain some of those cases, because we have all endured and dealt with those and today. So the facts are that even as we try to go back and retrospectively address or deal with some of these, we know that we're looking anywhere, even at best case, we're looking at 30 cents on the dollar that we're going to be able to go receive back. That's the best benchmarking we've seen in any of our customers. In terms of the impact here, we know that there is a significant impact not only to the provider operations group and trying to be able to ensure provider eligibility and try to gain insight as to where these providers are, but we also know that it has an impact to our members being able to be safely utilize the services that are provided. We can't let this information just slip past us, even with our best efforts. We've got to be able to work and improve and be better. That's our call to action. That's our case. And then this little thing happened that we've all run into, which is the latest trends that have taken some of these same challenges that we're all contending with and that have exacerbated the problem. I would be callous if I didn't at least acknowledge for everyone here that my comments are going to be just focused on the impact that we are seeing with the COVID issues on how that relates to a provider network. I do want to hopefully wish some hopeful thoughts to all of your friends and family. Certainly we have friends and family that are impacted by this both directly and indirectly, and our best to everybody that's here. In terms of what specifically we're seeing as some utilization changes and some other impacts relative to COVID. Number one, we're seeing increased testing. We've seen waived pre-authorization. We've watched and observed all of the historic utilization patterns being lifted to be able to free up any resources that any member might need. Rapid telehealth expansion has occurred in places and with providers that have never entered into this domain before. We have providers that are coming back into the workforce, many of them who are out, many of them who are seeing opportunity. We've seen the changes on interstate license portability. We're seeing and hearing all of those things that you are as well, which are providers that never ever should be eligible again to be able to take care of or look at a patient, finding ways to be able to get themselves back into this as well. These are the overall areas that we're seeing, and we know that it's creating a lot of challenges for organizations to try to be able to manage. In terms of even just license portability, let's look at this just for a minute. Even though across states, but even within states themselves, this is an example. This is actually an image from a primary source. The license or providing or sharing the eligibility of this individual provider. This was a license that was originally set to expire, I believe, on April 30th of this year. But with the state of Pennsylvania, the state entity that had issued said license has expanded or changed their remit such that any license that was set to expire is automatically going to extend into July 31st. Other states have followed suit, but not with a uniform approach in terms of what is going to create eligibility. So for example, in other states, they have said that it will be extended indefinitely, not giving a finite end to when this license eligibility should be able to continue. The challenge that this obviously creates, number one, is that your own data, your own systems, your own processes have to be able to absolve or take on these dynamic changes that are happening. But number two as we've increased utilization and allowed for interstate portability, now we have to become more adept at being able to understand other primary sources in other parts of the country and know all the nuances and changes that go along with anyone who is ordering and referring. That creates a massive amount of strain and pressure on the plans that we're working with today. As well, we know that there's more into the story. Anytime that we see increased or varied patterns of utilization, that creates changes that all of our models go out the window, and now anything that we once thought was normal is no longer. And as something is no longer normal, we also have created more doors and avenues that will allow these providers to be able to come in to these networks. We also know that with expanded utilization, expanded access, that leads to expanded utilization, it creates a cash crunch. So we know that a dual enrolled beneficiary or member is most likely to be treated by an excluded provider. The most vulnerable members in our populations are the ones that are most likely to be impacted. And that would create opportunity for fraud, waste, and abuse, putting more pressure on our organizations and driving a cash crunch that we already know that is hopefully a short-term issue, but longer term will require some more and broader strategic influence to be able to help shape and shift how we're performing as a business. Now, at this point, I typically put in some type of a picture just to try to make y'all feel better. So if you want to visualize a puppy or something nice in your life, because all of these things sound like they are unsolvable or insurmountable, let's just take a moment and say, look, we can actually address some of this. We can actually fix some of this. But let's talk first about some of the barriers that we have to be able to address some of these problems. We talked about the volumes and the overwhelming amounts that come in. We know that this is a dynamic population that we have so little information about. We know that there is varied amounts or bits and pieces of information that sits within our systems throughout the entirety of our organization. We know that we've got lots of doors for people to be able to come in, to be able to take advantage of or perhaps utilize some of these services. And there is fundamentally something that we see often, even though we're talking about where ownership rests for this in our business today. We know that there can oftentimes be finger pointing about how this happened. So perhaps the monitoring responsibility exists, but really we spend a lot more time trying to resolve the root cause or even just addressing a lot of the symptoms that we endure because of how people are coming into our organizations. So knowing that this is a challenge, it lives in different places. There are different departments. We already addressed that today. Provider ops or credentialing or compliance is trying to influence or cut across in this regard. We know that payment integrity, SIU, is trying to do retrospectives to be able to pull some of this back for us. There's lots of departments that have a strong need for this to be right, but it is not consistently owned. This also has lots of impact to any of our lines of business leaders, especially those who are running government programs. And there are lots of different systems that create complexity here. And these are just a few of them that are listed both internal to our business as well as externally. Primary sources alone create problems and challenges for us to be able to look at some of this. So all of these combine to create a lot of significant deltas in terms of how we might have historically applied some of our processes and systems to be able to monitor these complex populations. Okay. Diving into it just a little bit deeper, we've got all of these other requirements. We've got to be able to look at populations and do monitoring against the preclusion list for OFAC, the OIG LEIE, the opt-out list. We're going to NPES, or we're going to, in other cases, some of our own internal systems to be able to try to assemble or gather more information around it. And often when we're looking for these things, we'll have a name, maybe we've got some limited information of credential, but ultimately we often simply have an NPI by which we can operate with and some type of transactional record or history around these providers. Creates a tremendous amount of challenge for us to be able to address. With that NPI alone, if we're trying to do effective monitoring and just baseline trying to go in and check, for example, OFAC, that's a requirement that we're burdened with. OFAC has no other information except for an individual's name. So out of the box, if I have just NPI and I'm trying to go do monitoring against that OFAC primary source, we run into a business issue. But more specifically, even if we have additional data at the primary source, the data issue that we immediately run into, Dave, go ahead and advance to the next slide, thank you. The data issue that we immediately run into is a simple one. At the health plan, you may have this information about a non-par provider. And if you look at that record, you can see all the way through, you've got a name, billing address. This would be one of our clients that's more advanced or sophisticated in their NPI data capture. What they have, or sorry, in their provider data capture, what they have is an NPI, okay? At the primary source, even though this individual is an actual excluded individual, you could not find that individual if you only had the NPI because it simply is not listed at that source. As well, at the primary source, they may have a license number that in your own records you may or may not even have. So to be able to try to do that manual work and effort is where we end up spending so much of our time to try to reconcile it. And as well, it can even get a little bit worse. That's a healthy primary source. If we stick with the same concept where we're looking at an individual state exclusion list, for any of you who have a lot of providers in the state of Alabama, we know that this is a challenge for you because what you are looking at is the actual exclusion list from said state. So being able to try to bring this data into your world and be able to screen against it, number one, is a business issue. But number two, we didn't leave out any columns. This is the entirety of the record. This is all the information that you actually have to be able to reconcile the difference here. Okay, so these are the challenges that we know, the data world that we live in, and the ecosystem that we're trying to better manage. So let's try to figure out how we actually deal with some of this. Dave, go ahead.
Thanks, Mike. So to make this a little bit more engaging, we've got this a couple of poll questions back to back just to get us thinking about how we might solve some of the challenges that Mike has laid out. So this polling question, I'll go ahead and launch it, is you should be able to see it now. A non-par provider claim is submitted. For how long does your organization monitor that non-par provider? And the options here are any provider that has ever submitted a claim, any provider submitted a claim in the last 24 months, submitted a claim in the last 12 months, or submitted a claim in the last 6 months. We see results across the board, depending on the health plans that we partner with and some of the data that we take into our monitoring environment and start to think that way. And so I'm really interested to see sort of the folks on the phone, because we've got health plan representation from across the country and across different departments of what this looks like at your organization. I'll go and just give it another second or two before closing it out. And I will go ahead and close this poll and share the results. And so we've seen a little bit of all. About 38% of the folks on the phone categorize their non-par network as any provider that has ever submitted a claim. 15% of the folks on the phone would categorize their non-par network as any provider in the last 2 years. 23% would categorize it as any provider submitted a claim in the last year, and then 23% would categorize it as any provider in the last 6 months. So again, we really see a change in this, and I know Mike will address some of that as well. So as we continue to move through, the last section of our webinar today is best practices for managing and monitoring. And we do have one more poll question before we kick that off, and Mike kind of brings us home and talking about how do we actually take away some actionable key insights and next steps. The last poll question for today is simply the matter of frequency. So you should be able to see this on your screen, which is monitoring frequency. How often do you verify non-pars for exclusions? What does that look like? And again, we see this all over the board as we start to work with health plans. We've seen it everything from annually, quarterly, monthly, at time of claim or transaction only. And then we certainly see quite a few folks that say, I'm not sure. depending on where you sit in the organization or how confident you are in your organization's practices. So again, I'll give us another couple of seconds just to let our folks on the phone go ahead and vote. Just another second or two, and I will go ahead and close it out. And I will close us out on this and share the results. So you should be able to see this on your screen now. And the results, really, we have 0% said annually, 0% said quarterly, 45% of the folks on the phone said monthly, 5% said at time of claim or transaction only, and then 50%, the majority, or half of the folks on the phone actually said they're not sure, depending on where they sit or how familiar they are with their current processes. So Mike is going to get into just best practices for managing and monitoring and what we see as industry standards.
Thanks, Dave. Well, just like when Miles received his in-school suspension, the first step is the hardest one. The next day is the hardest one. But what we have seen is that when organizations that we work with do start to either put into place or more widely adopt and take a little bit more care and curation of these types of steps, we see them make a lot of progress. Okay? First of all, what we're going to start with is to say, let's define ownership as well as stakeholders and talk about how we're going to report on and share that. Secondly, we want to be able to look at not just establishment of best practice, but specifically around the areas of scope, criteria, and frequency. We're going to give you a couple of tools for that. We certainly think that in this day and age, that manual verification is something that we can enable, that data should trump all, and that quite frankly, if you're using the word fuzzy match, it is something we would like you to work on eradicating from your vocabulary. We also do think that there's ability to be able to bring these processes into existing workflows so that we can do more proactive, less retrospective work on trying to be able to solve this problem. In terms of finding a home, we often know that this can be a confounding and complex issue. I will never forget being in the room with several executives from a prominent regional health plan, where clearly the business issue was understood, but trying to find a home, or really the owner for who would solve this problem, was one that was challenging and quite frankly was not owned by any of the different department heads. In other organizations in which we've operated, we've watched where the assumption that it was being taken, or the assumption that this was happening because we were already doing certain processes for our PAR providers, that just ran prevalent throughout all of those team members and team leads. So what we most typically see, similar to the poll that we saw here, is that we'll see it take a home somewhere within our provider network, provider operations. We also expanded it to provider information systems. That's a subspecialty that we seem to be seeing become more prevalent within a lot of the organizations with which we're working. Certainly there are many stakeholders, but the ownership can live in that domain. We can talk more about why offline or where that goes in. And I want to be very clear to our payment integrity or SIU team members. This is not to say that this is not your problem. This is to absolutely say that you should be a stakeholder receiving the benefits of. We want this to be able to move up much sooner and earlier in the process so that you don't run into the same business issues. And hopefully you're cheering silently or even loudly at your desk when I say something like that. Next, we want to be able to look at establishment of our criteria, our scope, and our frequency. Criteria, what is it that we care to be able to monitor? What is most important? What can we look at based off of the limited sets of data that we have? The scope of this, what's the remit, or more specifically, that scope in terms of when do we start and when do we stop? We see some organizations that will monitor a non-PAR provider into perpetuity, and they may have only had one transaction from 4 years prior. While we appreciate the intent to be able to be diligent in processes, we more often see that as a symptom of inability to make decisions about when we should or should not purge those providers from our systems and do effective monitoring. The duration or recommended practice is one that your organization is going to have to define for yourself. Certainly, we would say at transaction only is likely short. The reason being is because you do have a burden from going forward. And if we're only looking at transaction, we can say that we did a check at that point in time, but there still is a burden for you that could impact not only the order, but any type of referral that would happen post-transaction. Happy to discuss that in more detail with anyone should they want to be able to pursue it. But understanding what and defining what is that duration that we feel like we have most effectively managed this. If your systems and processes are rapid and effective, there are methods to be able to do that that are very, very cost appropriate that help to mitigate you from any of the challenges you might run into later on. Knowing that we map those out, now we can take a harder look at saying, well, how do we monitor these by building out a monitoring matrix? And that matrix can really help to visualize where that responsibility does lie. In theory, we all understand what those requirements are, but in practice, until you actually visualize our populations and start to define what those are, you start to find gaps in both your data that you have to be able to do effective monitoring, but also in who owns doing that type of work. So this is a framework, and you'll be able to have access to this afterwards, that we use with our clients. It's a very simple framework, but it helps to ensure that we're considering what are the unique populations that we have to be able to monitor, and then what are the associated issues that go along with it. Now, to do all of this at the volumes that we're describing, and I remember the early guidance that CMS had provided relative to the preclusion list, if any of you were on those initial calls, you understood the initial challenge and rightly provided the right kind of feedback, which was there is no way we can take one NPI, go to a website and check that based off of the volumes that we have. We have over 400,000 non-par transactions, was one of our clients had shared with us. How do you expect us to do that? So certainly those processes have been amended. Dave, go ahead and go to the next slide. But trying to do this with every one of the populations that we are considering, and then adding into this fuzzy matches or limited bits of information to be able to come back and try to make a confirmed exclusion or decision around, just almost creates a level of inability to perform this work well. Fuzzy matches to us are just a symptom of bad data in and ineffective resources to be able to monitor against. Primary source data is difficult to be able to manage. We all know that. There are organizations, we are very biased, we work very hard at doing this, but there are organizations and resources that exist to be able to say, you can take that information and do something different with it to make it more readily searchable. Along with that, the data that we have and the way that we're trying to reconcile those two pieces creates a lot of confusion or dissonance. Our belief is that if you had good data on the front end that was clean, even if you only had the NPI, you should be able to associate that with the population of exclusions that exist in nature if you have good systems, good processes, and a good partner to help you solve that problem. If you're spending time trying to reconcile the differences on the two, and that's the bias of your time, then you've got a broken, antiquated process, and it's one that needs to be upgraded and revised. All of that being said, there is a way forward here, right? And the way forward is to be able to just go establish how we want to be able to think different about this problem as well as our solution. And our recommendations are just simply to be able to say, get that clarity of ownership, establish and publish those practices, and then the way that you do both, not only take ownership, but to help to ensure that those best practices are taken on, is to involve and enroll internal stakeholders. In God we trust, all others bring data. And the data that we shared with you today has been enough for us in some of the lines of business leaders that we've worked with to be able to say, we've got to rethink how we're trying to address some of these issues. In light of the cost crunches that we're facing today, we're happy to share with you this data and others to be able to help you readdress these problems in your worlds, right? Moving away from manual, moving into automation and integration with your existing processes is the way forward on being able to deal with non-par providers. Fundamentally, it's to be able to review this and then rinse and repeat. Hopefully, some of the recommendations, some of the insights we shared, some of the challenges that we know that organizations are facing, and as well as some of the recommended practices are items that you can take and actually do something with right now. That was our intent today. And Dave, with that, I'm going to sign off and let you share a few other comments with our folks here. Thanks.
Thanks so much, Mike. We do have just a couple of more things, including the results of the claims analysis that we walked through at the beginning of the call. And the first slide that we wanted to kick off and as we wrap this up and bring it home is selecting a partner for non-par monitoring. And just to give you almost a mini buyer's guide of how to do this and what does this look like. Certainly, as Mike mentioned, this is tough to pull off internally. So if you are in a position to look externally, here's just some considerations for you and for your organization. Is we would list these as the must-haves for any vendor relationship that interacts with the process of non-par monitoring, which is understanding the nuance and the complexity, enriches the primary source records with augmented data. I'll actually talk about that in a second on the next slide. Performs verification on your behalf and never uses the term fuzzy match to get your results or deliver results via a spreadsheet. Returns data that's actionable, allowing you to act, not investigate, and integrates seamlessly with your business processes and systems. Earlier, Mike shared the story of a claims analysis that we did on a non-par network, and I wanted to draw that to conclusion because I think it's really impactful about what you will see. So Mike mentioned we screened a non-par provider network across 2 states for a large health plan in this country of about 150,000 providers. When we ran that screen, we identified about 3,000 providers within that non-par universe that represented about $14 million in claims. When we broke that out and did a little bit more digging about that actual universe, here's what we found. Within those 3,000 flagged providers, we found 416 providers that had an exclusion associated with that represented 1.76 million in claims. We found 1,600 that had inactive NPIs that represented 10 million in claims. We found 911 on the opt-out list for Medicare, and this was specific to CMS lines of business, so Medicare and Medicaid. That represented 1.99 million in claims, and we found 36 invalid NPIs for $430,000 in claims. Breaking that down even further and looking at the exclusions on this, we found 288 of the 416 had current active exclusions that represented just shy of $1 million in claims that had already been paid out and processed by this health plan as it relates to their non-par network specifically. 134 of those were reinstatements, but many of those that were reinstatements actually had an active exclusion at time of transaction, not at time that we did the scrub, but at time of transaction. And then one waiver that represented about $227,000 in claims. And I mentioned before on the previous slide, enriching primary source data. This is something that we do at Provider Trust that really gives us the ability to partner really effectively and find things that no one else can to catch fraud quicker. And when we break up exclusions, of the current exclusions, 171 were a primary source match. So based on the data that we found and then we got from our partner health plan, we were able to identify just matching client data with primary source data. But 117, based on the data that we were given to us by our partner health plan, we had to actually enrich it with either an added NPI, an added license number, a changed name, an address change to actually find the exclusion on the primary source. So there's a gap. Sometimes your data in your master data management processes or current workflows might not actually line up with the primary source, depending on when people are excluded, what do they typically do? And that amounted to $300,000 that were paid out in claims for their non-par network that were currently, the health plan was currently struggling to recover. So I say that to bring you home because we wanted to help today. This is a time in the world where we as a vendor are doing everything that we can to help our health plans and healthcare providers as we all navigate COVID-19 and just understanding and managing to what the world currently looks like. For those on the call today, and there are about a few hundred of you on the call today, we are offering a one-time no-cost scrub of your non-par provider network to see what we can find. This is something that we've done in the past. The analysis I just walked through on the slide prior is exactly what we would do for you, just for free, for no cost, just to say, can we help, and is this of value to maybe even help justify the business case internally of where this should live in finding a home, or how it makes sense to enrich, augment, or enhance your current monitoring practices. So we are happy to offer that today. For those that may not know what we do have a software solution that's called Dash. We use this smarter, enriched data and monitoring to reduce the cost of recoupments for health plans. That is what we do. We do have some questions that came in. I know that we are running short on time, so rather than address them today, we are going to follow up individually with everyone that submitted a question to make sure you get that answered as it relates to non-par monitoring. And the final slide that we have today is just a little bit about our resources. To quickly recap, you will get a copy of this slide deck that you can use as a resource. You will get that first thing tomorrow morning. And we'll send this out to you via email, the one that you use to register for this session. So please feel free to use it as a resource as well. We also are recording this session as well, and you will get the recording that you can go back and listen to or share. We have released quite a bit of resource to help our friends and partners navigate COVID-19. If you simply go to providertrust.com, it's actually on our homepage. We have a link to some of our resources around aggregating license portability updates and what's happening in the world as it relates to licensure monitoring and monitoring for fraud, waste, and abuse in supply chain during and after COVID-19. So if there's ever a way we can help, we'd be happy to. That is it, friends. We greatly appreciate you taking the time and taking your lunch hour, depending on where you are, to spend a few minutes with us. We hope this was really helpful. We will make sure we deliver the resources from today's session to you first thing tomorrow morning. And with that, we're going to let you get back to your day. So thank you again, and we look forward to hearing from you soon.